Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Welcome to EAC Speaks, where we dive into the stories of change makers in public health, advocacy, and community impact. Today's episode is especially meaningful for me because our guest isn't just a leader in HIV prevention. She was my introduction to this work. She gave me my first role in the field, and her passion, energy, and dedication have shaped the way I approach advocacy today. She's the powerhouse behind Wards of Serenity, an organization tackling health disparities, substance use, and HIV through community-based education and outreach. We're going to talk about her journey, the challenges and triumphs of grassroots advocacy, and what keeps her pushing forward after decades of changing public health and its infrastructure. This is a conversation you don't want to miss. So without further ado, I introduce to you the Sybil Ward. Hello.
Hey, Eddie, how are you this morning? Thank you for the honor and privilege. I'm so excited to be here.
So glad to have you here. I know you as the powerhouse all across Arkansas, but can you tell the listeners and viewers a little bit about yourself?
Well, I am a mother of 3 beautiful Black boys, 2 grandsons, a wife. I am sister. I am a part of a family, a part of a tribe that has the privilege and honor to serve the community. Our kids were raised in this community service, so now they participate in it. And I worked for RAIN when I first started in 1994, the Regional AIDS Interfaith Network. Highly controversial. And it could have even been dangerous here in Arkansas. We work with people living with AIDS. They were actually dying from AIDS-related conditions. And so my introduction was one of a sense of urgency that I've never lost. Because if we can go there now.
Let's go.
Okay. In 90, wait, I probably do need to back up just a little bit for some personal information. Okay. I got sober February 3rd, 1994. And it was a miraculous miracle that the whole family was like, oh, thank you, God, this wild one. And so, but because I got sober, it was such a humbling journey. I came to the other side full of grace. Full of gratitude, right? With no sense, just humbled to draw breath.
Mm-hmm.
And also a heart for people that were hurting.
Mm-hmm.
And I took a part-time job at RAIN, the Regional AIDS Interfaith Network, as a receptionist because I was selling real estate, doing really, really well.
Mm-hmm.
But selling real estate, doing well. But when you sell real estate, it is feast or famine. Okay. You sell a house, baby, you got groceries. You can y'all can go to the movies. When it's famine, you are praying that these Roman noodles will feed everybody tonight until that check kicks in. So I took a part-time job at RAIN with the intention, part-time job as a receptionist with the intention to cover my grocery bill and utility. Okay, that was my intentions. So I am in 1994 sitting at RAIN as a receptionist, and I am meeting doctors, lawyers, dentists, preachers, men, women, moms, dad, kids living with HIV and AIDS and dying. Most alone and isolated. And so RAIN's job was to recruit the faith-based community. To walk with the faith-based community. So if we recruited a church, a temple, a synagogue, or a mosque, we then did a full training, legal training, infectious disease training, cultural competence training, all of that in the early 90s.
Wow.
They became a care team. And the
Mhm.
person that's living with HIV or the person living at end stage of AIDS would become the care partner. And they were adopted by the church.
Wow.
Now, you want to talk about something controversial in the
Mhm.
South, in the Bible Belt.
Right.
Training people of faith. They got good
Mhm.
hearts, but no education. When they
Mhm.
get the education to match their hearts and they can walk with a person, then it did not matter their background.
Mhm.
What it mattered was this was a valuable, beautiful human being from our faith, made in the image of God,
Mhm.
dying alone,
Mhm.
isolated. And so we had a real sense of urgency
Mhm.
because then people were getting kicked out of schools, being ran out of their house, businesses burned to the ground, they've been kicked out of neighborhoods. Children were
Mhm.
treated the most horrendous if they had a family member connected.
Mhm.
And I'm not going to even talk about the people how they were treated in the faith-based community,
Mhm.
particularly. I'm not talking about the ones that we train to know the truth.
Mhm. Mhm.
And so with that, if we could, people were dying alone. So we needed to train a care team
Mhm.
from a faith-based body. And it was ecumenical. Just like I said, there were care teams in churches, temples, synagogues, mosques. And when it came to the Christian faith, there was none. I learned more denominations than I even knew exist.
Yeah. Wow. Yeah.
Okay. And so they adopted a care partner, and we had to have 7 people.
Mhm.
7 because if you're on your deathbed and you're alone, okay, that's not politically correct, but I've been talking so long, I want to
Mhm.
that that with 7 people, and you could say, "I'll take Monday and I'll drop a plate off." I'm gonna say, "I
Yeah.
take Tuesday, I'll take a plate off." Somebody
Mhm.
else say, Brother Aaron can say, "Well, you know what? I'll take Wednesday and I can give them a ride to the doctor." So they
Uh-huh.
would bring them food, give them rides to the doctors, and it did not matter. They celebrate their birthdays.
Oh, I love that.
And so many people, care partners I would meet, say, "Girl, do you know how beat up I was in the church? Do you know how hurt I left the church with a bleeding heart? And now you want to bring a whole group of folks from the church here and I'm
Yeah.
dying?"
Mhm.
It was healing on both sides. It was
Right.
education
Right.
on both sides.
So
Said,
that was like 94. Like
yeah.
I I remember hearing such stories of, tragic times, but I love even hearing these kind of moments where community rallied together and it was real community. It was family, it's a tribe. We've kind of like merged a little bit away from that. There are still plenty of folks doing their work,
Hmm.
artwork, and I think as a general consensus, it's gotten kind of different. I would love to get back to that where we take care of each other no matter what is going on. And 7 people, that makes sense because the caretakers have lives, the care partners also have their needs. So
Hmm.
I love that. Do you still model that kind of like compassion, hard work, and efforts in your current like role?
Yes, because you and I both were taught first impressions matter, right? So my introduction came from a place when I was the most humbled and the most grateful to get grace with no judgment about anybody because I judged myself so hard that um, my introduction was a sense, as I said, a sense of urgency. There is somebody that's going to die alone if we are not there. But it's not so much about dying alone now as it is there is somebody we can prevent. If we get to them, we got to get to people as fast as we can and do this education and this testing. Testing is critical because of all the advancements now. The more people we test, the more people we test preliminary positive have an opportunity to go on medications that could save their life and have generational impact in their lives. Because you don't save an individual, you don't that doesn't check doesn't touch the past or the future.
Hmm.
right?
Yeah, yeah, yeah. You speaking good now. Look at you. Oh, about to pass the Benedict. I mean, the plate over here. I absolutely loved it. And it was after I did linkage to care where I realized that it's not about that situational moment for that person's life. Like, they may have gotten the diagnosis, that doesn't stop. And so, as a storyteller, I also had to remember, like, even using punctuation of examples of this is not a period in your story, this is a comma. So, like you said, there are so many biomedical interventions now. I'm on the injections. I go every 2 months. I don't even have to take a pill. I used to be so burdened by that pill. There's so many new advancements. We're
Mm-hmm.
working on a twice a year prep like shot, I think. There's so much happening to where we can educate the community so that it's not fearful. I think we used to work in fear. We operated in fear, and now it's more love. Like, it's all love. Like, we need to just spread the message of, I just want to be of service to you. The
Mm-hmm.
work that I do, I just want to be of service to you. So tell me this. There
Mm-hmm.
has been many changes. We talked about the landscape of the community. With a lot of the things, even with the administration, there's been many administration changes since then. What has kept you going over the years through the challenges, the public perceptions of substance use and HIV, and even the funding differences? What has kept you going?
Because it's my assignment. It's
Mm,
my call. Because it means something to the depths of me. I've had family members that have ended their journey from AIDS related conditions that I probably wouldn't have even known about if I wasn't called
hmm
to do this. And and it's incredible. I do want to say one thing though about the advances in medications. In the early 90s, when I would go and teach, we called it Compassionate HIV 101, because we
hmm
wanted to explain to people what is and what's not contagious so they could afford to walk in their compassion and not their fear, right? But I would never go anywhere without taking people with me living with the virus because I needed to teach and I needed for people to see that a person wasn't HIV. Right, is a person living with HIV, so they would give their testimonies all the time. But in the early 90s, Eddie, they would take 15 pills in the morning and then have to get past the nausea and the diarrhea and their stomachs balanced so we could travel.
hmm
And we traveled all over the state all the time. And so today, when you say that, well, I'm taking injectable.
hmm
And don't let me say anything wrong on this screen.
Yeah, injections. Yeah. Mhm. Yeah.
Every month, right? And I just think about the bravery of the people that serve by my side.
hmm
Most most are not here now
hmm
because the medication was canceritic, had horrendous side effects, and now it's so simple. People were taking 20, 30 pills a day,
Yeah, I
a
remember.
day.
I remember.
And so when I get to go into a treatment center, when I get to go into a girls and boys club, and now I'm saying the best place you can test positive is here right now because it can change your life forever. We can get you into care, and that the care is exceptional now in regard to the treatments. But there's still a lot of work to do. Even I used to teach a class on customer service, telling people somebody get a diagnosis, I ask them to come to your clinic, and then you got a stank attitude.
hmm
That's a deterrent to health.
Absolutely is.
But go ahead.
Mhm.
That's a
No,
whole
I
other
appreciate you saying that because I stand on the shoulders of so many folks that have come before me and folks that I've lost, folks that are still here, grateful to still have them. But hearing those stories, I don't ever take any of that lightly because people have to struggle, and I thank God for research and I thank God for them, the bravery that they had to endure to actually get to this place because many people lost their lives during research trials of what AZT and all of the other medications. So to see that now, I sometimes will complain about my one pill, and that's what kept me going because during the early stages of my diagnosis, I did not want to take medication. And when I complained about the one pill, I thought about my cousin's friend who would have to take a handful of pills in the morning, some in the afternoon, some
Mhm.
before he went to bed. I
Mhm.
said, you should be more grateful. And that's where I am today. So grateful for the advancements, but always having to remember that there was a story before this little bitty shot.
Right. Right.
So tell me this. You
Mhm.
have had such a wonderful like career. I'm in this place of like really I'm almost burnt out. I will admit that's me being transparent.
Mhm.
What is one lesson that you wish you had learned earlier on in your career?
I still think what I do is critical. No, I still know what I do is critical, and I still know that I have got to teach people to replace me.
Hmm.
This must be carried on, but what I didn't do well was balance.
Hmm.
It is important for mental health, for physical health, and for clarity. I didn't want to do that. I just wanted to, I wake up on 10 and I like 10.
Yeah.
Run hard, run hard, run hard. I have days when I am in like 3 or 4 different facilities
Mhm.
at 65 years old, teaching and testing.
Hmm.
One day. I mean,
Wow.
but okay, that was last week. But I mean, week before last, before the snow. I was teaching classes yesterday and then last night. So, but balance is critical because
Mhm.
burnout is real, and there are
Mhm.
people who are who have a heart for this and who is willing to go through the hard things for this,
Mhm.
but they don't take care of themselves. Often givers are not good receivers. I'll
Mhm.
give you my time, but I need to give myself my time. I have to have some balance. And one of the things I started doing, which I'm not doing good right now, was like
Mhm.
Mondays. Mondays, I got to catch up on paperwork.
Mhm.
Mondays, I need to make sure that I'm on top of my billing, my asking, my giving. Monday, I don't need to be in the field, and I don't no lack of love for you, but I need to
Mhm.
serve Wards of Serenity's paperwork
Mhm. Mhm.
because if I drop the ball there, then there's no Wards of Serenity,
Right.
right?
Right.
Okay, I got designated days I prefer to do outreach, but I'll do outreach any day. But
Mhm.
and then I had to have time for say, okay, Monday night, Thursday night, these are nights that I do something else. It's all about celebrate recovery for me
Okay.
on Tuesday nights and Thursday night. And so, but then I got to have time for my grandchildren. I had to
Mhm.
have time. I got an old husband and I really like him, so I gotta
Mhm.
have time for that
Yeah.
brother, right? Family is important.
It
Yeah.
is. It is. I love that you said balance because I used to preach work life balance and I was not great at practicing what I preached. Okay.
Mhm.
And I think it's important for us to take care of each other and that accountability. I'm
Mhm.
such a bad receiver. Like you said, I give more than I like to receive, and so I don't even sometimes like people asking me like, "Well, Eddie, what did you do for yourself this week?" Because I'd be like, "Girl, I know I'm supposed to do something," but
Mhm.
it's hard. So I think this was a confirmation of like you need to balance some things out, and I like having days designated for something. So
Mhm.
thank you for that. Now you talked about Wars of Serenity's paperwork. Let's talk about what it is that you all do. Like, where can people find you? What are some of the things that you're working
Okay, one of the things is we do a very robust HIV, Hep C, substance abuse prevention, education, and testing. But another part of the thing that we've done that I love is collaborate with other agencies. It There can be agencies like there are agencies that do HIV and Hep C testing all day, just like us. So we invite them to do Hep C, right? So we both can get out there because there's not a lack of need, right? But we don't need to get lost in keeping everything so close to the vest. It works better for us. If you do Hep C, we link arms with you. Somebody else do substance abuse. We do arms. We do. This is nothing we can't do, but we're stronger together. There's somebody that does services we don't do. We want to bring them all to the table. If we're going to go, we want as many other CBOs to come too, so that people can get and it also helps from the stigma that still exists with HIV. People don't line up to get an HIV test. We was in the church, uh, 2 weeks every other week, last week and the week 2 weeks before that, we were in the church. People not lined up to get an HIV test in the church, but when I say, "Come get your blood pressure and a gift card," okay, I can get my blood pressure, and okay, we'll get an HIV test when you're here.
Mhm.
Knowing they need that, eh, knowing they need the HIV, want the HIV test. It's so interesting. So people like, I don't need that. I'm good, right? But if you need to get your blood pressure and then the HIV test, just get it all. And I'm always saying everybody's doing it. Yeah, come on. Hmm. Yeah, don't blame me. And so sometimes I tell these good folks, like, don't blame me if you're not getting lucky. We want to test for what you already did.
Yeah. you be probably gagging them at the church. They be like, "Oh, what's my
Yeah,
mom?"
exactly. And so, so then we get to test 20 or 30 people
Uh-huh.
that would not have been tested.
Right. And
And
they
they
get
get
to
some other
learn
stuff
something
too.
that they probably didn't know.
And one thing is really important to me. I don't want to test people for anything unless we can refer them to where they can get care. Because
Mhm.
all of our staffs have had all of us have had the VCT training for HIV, and
Mhm.
half of us have gotten a syndemic training. So it's Hep C and all of the STDs as well. And when I worked at Rain, everybody had to have clinical training as a chaplain, no matter your function. And we all had to be trained because we needed to meet people where they
Mhm.
are, right? I
Mhm.
meet you exactly where you are with
Mhm.
your character defects, your flaws. Some may be glowing, some may
Mhm.
be small, but
Mhm.
so I don't get to have judgment. I get to meet you where you are, but at the same time, I'm empowered to meet you where I am. I
Mhm.
can be broken. I can
Mhm.
still have wounds my own self. I can still have struggles and walk with you, right? And so I think it is important today as it is then. Everyone on my team, if your function is media, if your function, whatever it is, we all are trained because we all need to be able to serve whom we're called upon. And we do. So we're serving the state of Arkansas, and funding continues to keep me reading, praying, and writing. What about you?
Okay, got to keep that money coming through. Got to keep the services. Now, you talked about having different kind of outreach. Is there something that you look for when you say yes to an event, or is there some type of collaboration that you look for when you saying yes to an event?
When I work with collaborators, if you and I collaborated, I need people to be, for me,
Mm,
forthcoming. Really, it makes a big difference for me because I have a lot to have to put together, and you'll have a lot. If it's not going well, I need to know, so in case I can help do something. And if I call you and say, "This my struggle," I need you to be willing to be a real partner in less serving the people. And when people call me, like everybody, I prefer a 30-day notice. But if you call, but people have called me next week, so and so was coming, they dropped the ball, and we all would like to do this. If I can, I will. But my staff have grocery bills too, so I need to make sure that I don't have full staff and nobody to serve. I have to be frugal with the resource. I have to be a good steward of what we have. But what we have is not for us. It is to serve. And so I didn't give you a phone number or nothing, did I? You did ask me how to get in contact.
Well, I was going to revisit that. Let me ask you this. I have another question. If you could create an initiative, a program, or a policy change, and you had unlimited resources, people, money, buy-in, all of that, what would you create?
If I could do anything I wanted, I would I would acquire an empowerment center where all the agencies could come. And it's not the first time and it's not new. But what if we all could have a quality, nice office? What if we didn't spend as much time raising money to as we do working? Spend time raising money so that we can work. But what if we had a nice facility that we were proud of with secure parking and people came at some of the scariest times in their lives and were treated with value and respect to come to a place that looked really nice and all of it had for them in mind, for the people that walk through the door, the ones that are just coming for a free test, the ones that are coming for confirmatory tests, for those that just need to talk to somebody or have some concerns or need a referral and have some health care on site too, quality trained health care that are not curious about your body parts as they are about whatever symptoms that are presenting and the most current uh, treatment. What if we had that where people were respected exactly where they are?
Mm-hmm.
And and a place where people could practice their faith
Mm-hmm.
as well as their health, or fun activities or outreach events, something that was collaborative and available all the time, if our money was no issue.
Right? Yeah. Wait till I get rich. I'm going to have the Sybil Ward Empowerment Center in Lubbock, Arkansas.
Okay, but it would also offer services. I'm talking about thrift store,
Well,
haircuts,
yes.
styles, braids, nails.
Yes. That's like,
Yeah.
I love that. Like,
Mhm.
that's just real. Because when we talk about HIV prevention, and I've always believed that we can't look at the monolith of just one person, because you got to look at all my needs. If
Mhm.
I don't have the money to get my hair done, I may have an interview, or I may have an audition or something. You
Mhm.
have that braider in your office, and they say, "Well, hey, look, I got you. I'll do a little quick style for you." So it's all like mutual aid, right?
Mhm.
I think that's important.
Yeah, but in my
Oh,
vision, everybody got their own office, okay?
oh yeah, yeah,
And the
yeah.
hair, they doing the hair right here across the
Not just
hall.
that
They
one
doing the
little.
nails, okay?
So we're going towards the end of the show. Is there anything that I didn't ask you, or anything that you would like to leave the listeners and viewers with?
I know that in the beginning, when HIV was introduced to us, it was introduced with stigma and propaganda. And I know throughout, fear has been sewn into every step of advancements that we made. And I know that in this particular time, funding is precarious at best. That is important, regardless of what you think or believe. HIV stands for human immune deficiency virus. It could affect you or affect you, and by touching the people you love. It is important that we carry prevention messages and recognize the importance of our diversity, offer equality every time we can. And we need to be inclusive in our compassion and our gifts, just like we would want to receive them. It's critical.
Hmm. Just well, well said. I couldn't have ended it with better words. But what I want you to do, we forgot to give the number or Facebook towards of Serenity. Like, make sure people can find you. We want them to follow your pages. I know you're on Facebook.
Wards of Serenity, just go to Facebook and put Wards of Serenity. Our email is wards, WARDS, WOFSERENITY. Words of Serenity at Outlook.com. Words of Serenity at Outlook.com. Go to Facebook and find Words of Serenity. Our phone number is 501 480 2084. Again, 501 480 2084. And I would just ask you to keep in mind, we want to be in the field, and most days we are in the field. So if we don't answer the phone, it is very important you leave a message because we want to hear from you. We will respond. And we respond on weekends too. And after hours, we don't after 8 because one of my boundaries is no more electronics at 9 other than a television or a book. Yeah, I don't answer the phone because I need to sleep so I have the energy. So that's a bedtime is a good boundary. At least to shut down, okay, because don't get me wrong, I got stuff that I'm into. You know, my husband and I got our TV shows and all that, but then that means I'm not on the phone. I'm not checking my phone. My phone is over at 8 o'clock. I don't even answer a phone at 9 at all if your message get through somehow. But but I want you to know we want your calls. We want your emails. We definitely want you to go on Facebook and reach out to us if you want us to join you in an event, if you want to join us, if you're looking for some volunteer opportunities, right? And sometimes people are in recovery and need sheets signed for going to meetings. We can help make referrals for that as well.
This has been a great episode to share resources. I also learned some things that I wrote down. So I am super grateful for this and really will be looking forward to possible future comings on to EAC Speaks.
All right. Thank you.
Of course. So thank you, everybody. And remember, if you're out there and you would like to be on EAC Speaks, hit us up. You can go to our website. You can go to our socials. Hit us up on any platform. Make sure you check out Wars of Serenity on Facebook. And if you need anything, call them. They'll answer. Leave a message. All right. Until next time, we'll say ciao.
Bye.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.